Let's return to the journey that you had through the cancer process and the treatment. You mentioned now about the surgery. What other treatments followed the surgery for you?
Luckily, I didn't need any chemotherapy, and I was quite frightened about that. I was also frightened about the radiotherapy. I was really, really frightened. Although I supported a lot of people that went themselves through radiotherapy, surgery, etc., chemotherapy. But I can remember my first day when I went for my first treatment. I was so anxious and I was so scared. I was scared to death. But the people at the department helped me to cope with that. And after the first treatment, I just feel, oh, it wouldn't be easier than that with all their support and their soft words.
You found that it was manageable in the end?
It was manageable at the end, yes. Yeah. And yes, I flew actually through my radiotherapy. And then I had to start on anti-cancer drug therapy. I started, but had quite a frightened experience that I got an allergic reaction with the tamoxifen that they put me on. I had to rush to hospital and then back, but the oncologist supported me through that. I stopped taking that for a week or two and was restarted with the therapy until about 3 months ago, where I got very, very side effects that was my quality of life definitely decreased with that, and the oncologist decided to stop the treatment for a couple of months.
Do you want to mention those side effects, because they're potentially ones other people might be familiar with?
The side effects was, the flushes and the hot turns.
Yes.
That's definitely not a nice experience. But not just that. Every week or so I had vaginal reactions due to that, bleeding, thrush-like symptoms. That was not very nice. And until at the point that I just said to myself, no, I can't cope with that anymore. The hot flushes I could cope with. The warm feeling I can cope with that. But every week with this kind of symptoms, I was not very happy. So the oncologist decided with that we can stop with the treatment.
Yeah, I mean, sometimes if you're able to discuss these side effects, even if they are potentially difficult to mention in the appointment, often a alternative treatment can be found, or some modification to the regime given to make things easier. In your case, I think the medication was swapped. Is that
yes, right? The oncologist put me on another treatment, Remedix.
Yes.
And I don't think it's because I'm a nurse, but I got that side effects as well.
Okay.
And I didn't know I have so many joints in my body. As a nurse, I should know, but as a patient, I didn't know. The pain that I experience now, I cope with that. But it's still, I have to take pain medication for that. Otherwise, I wouldn't cope.